We are Group D, and the issues we are discussing today are osteoporosis, chronic heart failure, and osteoarthritis. I'm Remy, and I'll be talking about the study concerning osteoporosis. This study randomized a large group of elderly females who had osteoporosis, were postmenopausal, and had low bone mass to either participate in low-intensity home-based control group or supervised high-intensity resistance and impact training. The control group consisted of a large group, while the high-intensity resistance and impact training was a medium-sized group. The pros of this design are that the groups were randomized and the length of the exercise programs, which made it easier to detect the bone mineral density outcomes. The cons of this design were the safety concerns around high-intensity loading for elderly women with low bone mass, which have previously discouraged others from recommending or even testing it as a therapy for osteoporosis. For the resistance training portion of the intervention, the high-intensity resistance and impact training groups workouts included free weights and high-impact lifting that targeted the lower and upper portions of the body. On the other hand, the control group consisted of low-intensity home-based exercises designed to improve mobility and balance but minimize stimulus to the bones. The control group's program remains in the endurance phase, while the high-intensity group progressed from endurance phase to the strength phase. To ensure safe transition to high-intensity exercise, the first month of the intervention comprised body, weight, and low-load exercise variants, with a focus on progressively learning the movement patterns of the high-intensity exercises. The high-intensity resistance and impact training intervention was significant because the duration and progressive nature of the 8-month program were connected to the good results of the bone mineral densities and muscle strength of the participants. Muscular strength improved in the back and legs for both of the control group and high-intensity resistance and impact training group. The bone mineral density actually decreased for the control group while it drastically increased for the high-intensity group. Because both groups participated in resistance training only, you would expect to see both groups increase in muscle strength. However, the decrease in bone mineral density for the control group was unexpected. In summary, the 8-month-long program of strictly only resistance training increased muscular strength for both groups, but the differences in bone mineral density results were caused by the intensity of the training. I would recommend this program for elderly women battling osteoporosis because the higher intensity group saw larger increases in both muscle strength and bone mineral density levels than the control group.
Hi, my name is Aubrey Cosgrove. This study randomized a medium group of middle-aged postmenopausal women with the risk of chronic heart failure who have gone through a full year without menstruation and who have also must obtain regular eating patterns without a medicinal diet. The high-intensity interval training group, the HIIT, the moderate intensity aerobic continuous training group, which is the MIACT, and the control group, which is the normal daily regular physical activity level group, were all small sample sizes. The pros of this case study design are that it was randomized, and the cons of this case study design was the small sample sizes with all of the groups, which makes finding a significant effect due to the intervention less likely, even if the intervention is good. For the aerobic exercise of the intervention of the HIIT, participants were prescribed to perform vigorous treadmill sessions, which meets the physical activity guidelines. The aerobic intervention was significant because the relationship between the heart rate reserve and the duration were connected, with vigorous exercises on the treadmill for 90 minutes a week simulates a sufficient aerobic response. For the first 3 weeks of the aerobic exercise intervention of the moderate intensity aerobic continuous group, the MIACT group, participants were prescribed to perform moderate treadmill sessions that did not meet the physical activity guidelines. Though there is an inverse relationship between the heart rate reserve, frequency, and duration, even with moderate intensity, there is not enough weekly duration or frequency to simulate a sufficient aerobic response. Then for the next 5 weeks of the aerobic exercise intervention of the moderate intensity aerobic continuous training group, the MIACT group, participants were described to perform vigorous treadmill sessions which met the physical activity guidelines. The aerobic intervention was sufficient because the relationship between the heart rate reserve and duration were connected with vigorous exercise on the treadmill for 90 minutes a week, which simulates an sufficient aerobic response. The control group, the normal daily regular physical activity level, participants were instructed to follow their normal physical activity levels and current daily activities during the 8-week intervention period. Therefore, there was not any specific intervention they were to follow. The high intensity interval training group, VO2 max, improved significantly, although the body fat and the triglyceride and total cholesterol decreased throughout this 8-week study. For the MIACT group, the VO2 max also improved significantly, although the body fat, the triglyceride, and the cholesterol decreased through this 8-week period. There is no results in muscular strength for either group because there was no endurance exercise performed. Since the intervention only lasted 8 weeks, it was not expected to have a huge change from baseline value to post value. For example, based on the duration of this study only being 8 weeks, there was not enough time for the triglyceride and cholesterol to improve. Also, the small sample size with all these groups affected the results as well. The control group, the normal daily regular physical activity level group, showed that there was no significant change in the VO2 max and significantly increased in the body fat percentage and the cholesterol and the triglyceride. Due to this fact that there are no exercise intervention performed for this group, there was no specific change. So GAL3 gene has been identified as a biomarker with an independent prognostic value in new onset acute and chronic heart failure. The GAL3 gene in the high intensity interval training group and the moderate intensity aerobic continuous training group decrease after 8 weeks of training protocol. Although the decrease of the GAL3 gene in the HIIT group was higher than that of the MICT group. The control group change in the GAL3 gene expression was a lot greater. The results show that the high-intensity interval training group, the HIIT, is superior to the moderate-intensity aerobic continuous training group in improving the decrease in heart failure in postmenopausal women. The high-intensity interval training, the HIIT group, could be recommended to help decrease the risk of chronic heart failure, although this intervention should be performed at a duration longer than 8 weeks to have a long-lasting effect.
The study randomized a large group of middle-aged and elderly men and women with knee osteoarthritis who could participate in either aquatic cycling or the usual care control group. Both the aquatic cycling group and the usual care control group were large. The pros of the design are that it was randomized and contained a large sample size. For the aerobic portion of the intervention, participants were prescribed to perform aquatic cycling intervals at a moderate intensity at an amount which did not meet the physical activity guidelines. There is an inverse relationship between volume and intensity. At this intensity, the volume would need to be doubled for the week to stimulate an adequate aerobic response. For the resistance training portion of the intervention, the workout included assistance lifts that targeted the upper body and were performed in the water while cycling. The workout started in the hypertrophy phase and remained there. What is a good idea to include upper body exercises? It had no bearing on reducing pain or functioning for knee osteoarthritis. The major results of this study included quality of life improvements for those suffering from knee osteoarthritis. The participants in the aquatic cycling group performed aerobic exercise and some water resistance exercises. These proved effective at improving physical functioning and pain reduction in their knees. The timed up and go tests showed a decrease in the amount of time it took them to perform this test. Though quality of life and pain reduction were improved, additional resistance training outside of the water seems appropriate for people suffering from osteoarthritis to reduce pain and improve joint functioning.
Hi, I'm Mary Jo, and I'll be talking about the comparison slides. In this study, osteoporosis and osteoarthritis both had large groups, to where chronic heart failure had a smaller group. All three of these studies were randomized, but none of these studies were deficient in this category, however small. Although 2 out of the 3 groups were larger, they all came out with important outcomes. In the study regarding chronic heart failure, there was no deficient category. However, it was unexpected to have such good outcomes based on the tiny sample size and length of study, which drastically increased. The study for osteoporosis was high increase because of the higher intensity muscular strength of the 8-month program, which also helped increase bone mineral intensity. There was no terrible workouts, but there was safety concerns due to high intensity training equipment that elderly women were using, which they ensure safety transitions. Based on the outcomes, we can conclude that all 3 studies gave significant results, but could have been a better outcome if they had larger or bigger groups.
This is our final recommendation slide. For 61-year-old females with chronic heart failure, osteoarthritis, and osteoporosis, we recommend the following. For aerobic exercises, we are recommending walking or jogging on a treadmill or outdoors and aquatic cycling. However, these aerobic exercises do not meet the physical activity guidelines. For resistance training, we recommend shoulder extensions, elbow curls, overhead curls, and deadlifts with sets of 3 to 5 with reps of 8 to 12 at an intensity of 75% 1 RM. Prior to these resistance training exercises, we recommend some light stretching for 5 minutes before each exercise, lunges and calf raises 10 reps each, and a 1-minute long shoulder stretch to warm up and relax the body. We did, however, have to eliminate some exercises so that our recommended exercises were safe and manageable to do for our age group of females with chronic heart failure, osteoarthritis, and osteoporosis. Along with that, we also had to reduce the intensity of our resistance exercises recommended from our osteoporosis article to better apply to our 2 other groups. And we then decided to set the intensity at 75% 1 RM. The components of fitness we want to improve are the strength, balance, and cardiorespiratory fitness. For a client, for example, with a physical impairment due to osteoporosis, such as low bone mass, our major target is improving their bone mineral density. The exercises recommended for improvement are deadlifts and overhead presses. In summary, these exercises of both aerobic and resistance intensities would not fit all our clients' needs, but with the discussed intensities, reps, sets, and exercise durations, there will be significant improvements to their conditions. Oh, geez.